Governor of the Eastern Caribbean Central Bank, ECCB, Timothy Antoine, said based on two of its assessment, economic activity across the Eastern Caribbean Currency Union is expected to contract between 5 and 7%, with a sharp rise in unemployment. He was addressing the impact of the COVID-19 pandemic in a video statement published this past weekend.
At this juncture, the International Monetary Fund is projecting that the global economy will contract in 2020 on a magnitude same as or larger than the global financial crisis. The extent of the economic impact depends on the length and severity of the pandemic, and those are still unknowns at this time. The ECCB has run several scenarios for the ECCU. Based on two such scenarios, economic activity in the ECCU is projected to contract between 5% and 7% in 2020, accompanied by a sharp rise in unemployment. Now keep in mind that prior to this pandemic, economic growth in the ECCU was projected at 3.3%.
In response, the ECCB is implementing several measures to address the impact of the pandemic. Governor Antoine outlined these measures.
Provided financial support to member governments through a $4 million grant, $500,000 for each member country from the Fiscal Reserve Tranche 2. Second, reached an agreement with the ECCU Bankers Association on a loan deferral program for customers for up to 6 months. A waiver of late fees and charges is applicable to eligible customers during that period. Third, created a page on the ECCB's website to provide information on the bank's COVID-19 response. Fourth, discussed a loan deferral program for customers with credit unions, the Caribbean Confederation of Credit Unions, and national regulators. Fifth, increased government share of the credit allocation budget, thereby increasing the central bank's lending capacity to member governments. Sixth, instituted bank-wide telecommuting, working from home. And seventh, reduced the discount rate to 2% from 6.5%. This is the rate at which the central bank lends to governments and banks. Our central bank has also convened meetings with ministries of finance to support the development of national and regional responses to COVID-19. The ECCB is working very closely with the OECS Commission on procurement of critical supplies, assessments, resource mobilization, and coordination. The ECCB is also actively engaged with the IMF and the World Bank Group on assistance for our member countries. Our central bank continues to provide currency to financial institutions in every member country to ensure, for example, ATMs, ABMs can be restocked as needed. In respect of payments, our central bank continues to play a vital role in ensuring payments are made on time, including payroll and pension payments for governments and social security systems that use the electronic funds transfer platform. The foregoing actions have been taken to ensure that the ECCB effectively serves our region at this time.
Meanwhile, in looking at how things can improve in the aftermath of the pandemic, Governor Antoine advised that the thrust now in beefing up food security across the ECCU should continue even after the health crisis has receded.
Once again, the issue of food security has come into sharp focus. Recall 2008, when food and fuel prices peaked and the regional conversation about food security ensued. Going forward, as part of building resilience, we must ensure our focus for enhancing our capacity to feed ourselves does not shift when this crisis recedes. It has happened before. It must not happen again.
The ECCB governor pointed to the serious economic impact expected across the globe as a result of the pandemic and stressed that this crisis was unprecedented. As the coronavirus COVID-19 pandemic continues to surge worldwide, the World Bank and International Monetary Fund, IMF, recently called on all the official bilateral creditors to suspend debt payments from the world's poorest countries, if requested, so they can battle the deadly virus. Andre Huey, SKN Newsline.
Customers of shops and grocery stores in rural areas have been complaining that many outlets are almost out of food supplies. It is a reality that comes as a consequence of many measures being taken to reduce the possibility of community transmission of coronavirus COVID-19 that has impacted the entire world. On days of the partial curfew on St. Kitts and Nevis, when residents and citizens shop in rural districts, they are faced with almost empty shelves, and some shops could take hours to restock. Clearly, food distribution is under stress, although authorities have consistently said the country is not short of food supply. President Giselle Matthews of the Chamber of Industry and Commerce provides insight into the difficulties.
We know that there's been challenges on that front, but that is really, you have to understand, that has come from the fact that we are focusing predominantly on getting that cargo out at the port, unstuff those containers and getting the shelves stocked. So what has happened is many of the retailers have been, their warehouse facilities for distribution have been somewhat halted at this time, so that they can focus on getting the goods out and being ready to adequately supply the demand that is there on the shopping days, which is tremendous, as you can all see. So here's where I said to the general public, if you live in a rural area and you have shops out there that do have basics, the Attorney General has spoken to this time and time again, purchasing the essentials, the things that you truly need that can sustain you, because those small shops carry those basics. Okay, so we'll speak about price. We will have the discussion about, the possibility of looking at how we can discuss as a chamber with our suppliers on, managing the pricing structure, the wholesale pricing to those small shops. Price gouging is something that we hope is not taking place, but again, that's Consumer Affairs will have to do their exercise and their homework in that regard. But in terms of the distribution, we are working with Mr. Samuel and his team. We have some ideas on different angles that we can go from in terms of food supply. So we're looking at different options at this time, hoping to roll something out from our major distributors, our major food distributors that can work in possibility of deliveries online, those kind of options. These take time, but when we have that detail and we know what we can do to assist, we will certainly be letting the general public know. So again, stick to the essentials. Don't come into town unless you absolutely have to, and put the extra strain on the public system and on the supermarkets.
Many are hoping that a remedy will be in place for the next partial lifting of the 24-hour curfew to allow as many persons as possible to obtain essentials they need. Glenn Bart, SKN Newsline.
Protect yourself from the novel coronavirus. Wash your hands thoroughly and frequently for at least 20 seconds each time. Avoid shaking hands and touching your face with unclean hands. If you have to cough or sneeze, do so into your flexed elbow or a paper towel and then dispose of it. Keep a distance of 3 feet away from anyone with the cold or flu-like symptoms. Boost your immune system with vitamins, drink plenty of water, and get adequate rest. Visit your doctor, the nearest hospital, or health center if you or a family member becomes ill. A message from the Ministry of Health and the National Emergency Management Agency, NEMA.
At Nagico, the things that matter to you matter to us. Like knowing you're covered when your house gets flooded. Getting your settlements quickly and fairly when a fire hits your home. And making sure your business can keep going even after an accident happens on site. At Nagico, we're about much more than just insurance. We're about the big things and the small things that mean everything.
Hey, scan this. Boy, what that stand for?
We are St. Kitts and Nevis Waste Disposals.
Oh, so it's I just rent the big bin for when people cleaning the yard and construction project and so?
Yes, we do that.
Okay, so what about septic tank and grease trap cleanings?
Yes, we do that.
Them portable toilet rental?
Yes, we do that.
So what about if I want to rent a sexy bar trailer for like VIP events or my outdoors wedding?
Yes, we do that.
Residential garbage pickup?
Yes, we do that.
Okay. So if my office have a bunch of documents we need shredded?
Yes, we do that.
Boy, I talking to you, man, you know. But when you answer me, I hearing like 10 people.
That's just the strength of our team working for you. Watch now. Call us at 662-3329 and we'll come and do that for you.
Like us on Facebook.
Medical Chief of Staff Dr. Cameron Wilkinson said it was important to understand the guidelines for mask wearing during the COVID-19 pandemic. In comments made at a media briefing, Dr. Wilkinson said he had calls asking about the purpose of the mask as well as when it is necessary to wear the mask. Confusion about the mask wearing could be the result of a variety of advice coming from different sources, some official while others are not. According to Dr. Wilkinson, it was necessary for him to clarify the matter.
A cloth face mask covering should be worn whenever people are in a community setting, especially in a situation where you may be near to people, and these settings include groceries, pharmacies. These face coverings are not a substitute for social distancing. These face coverings are especially important to wear in public in areas where there is widespread COVID illness. Wearing a cloth face mask covering in addition to public health measures should help to reduce the spread of COVID-19. It is still recommended that you stay at least 6 feet away from other persons, that is social distancing, and do the frequent hand cleaning and other everyday preventive actions. A cloth face covering is not intended to protect the wearer, but it may prevent the spread of virus from the wearer to others. This would be especially important if someone is infected but does not have symptoms. Cloth face coverings can be made from household items or made from common household materials at low cost.
In addition, Dr. Wilkinson pointed out that not everyone should be wearing masks and explained why.
Cloth face coverings should not be placed on younger children younger than 2 years of age, anyone who has trouble breathing or is unconscious or incapacitated or otherwise unable to remove the cover without assistance. This doesn't necessarily mean that you need to be in the supermarket with a 2-year-old child without a mask. It means that these persons who cannot wear a mask, they should be kept out of the general population.
Dr. Wilkinson said the surgical masks and the N95 respirators are in short supply globally and must be reserved for healthcare workers and medical first responders. Glenn Bart, SKN Newsline. St. Kitts and Nevis recorded its 12th case of the coronavirus COVID-19 with just over 200 tests performed in the Federation. According to Health Minister of State Wendy Phipps, the 12th person to have confirmed COVID-19 infection was revealed in the latest batch of 23 tests done by Carrefour Laboratories. The Health Minister indicated that the 12th person had direct contact with a previously confirmed victim of COVID-19.
We have, as of today, an additional confirmed case of COVID-19. And of course, the individual is an Indian national who happens to be of the age of 21 years old, and that is our most recent one. Just last night, we would have received a number of test results, 23 in total, of which 22 were negative, and the one positive that I just mentioned. So we are grateful to God that we had only had that one among that large number of results. Our 12th case, as I said, is a male individual, and he would have had direct contact with an announced case, a previously announced case that we would have divulged to the public some time ago. The individual, for the information of the public, had been placed in quarantine since the 29th of March when he was first named a contact of a previously confirmed case, and subsequently he would have been sampled and tested, and of course this was able to be done because of the aggressive contact tracing that we have put in place. So it now means that this individual would now be in mandatory isolation, which is more stringent than the previous quarantine situation that the individual would have been in. As such, there are 29 persons who are quarantined in a government facility, with 159 persons quarantined at home. 12 persons as it would make sense now, are in isolation because we now have the 12th confirmed case of COVID-19.
The latest victim of COVID-19 in the Federation comes at a time when the World Health Organization is warning against the lifting of lockdown measures too early. Glenn Barth, SKN Newsline. Medical Chief of Staff at the Joseph N. France General Hospital said St. Kitts and Nevis was not in a stage of community transmission of COVID-19. Speaking at a media briefing from the COVID-19 National Emergency Operations Center, Chief of Staff Dr. Cameron Wilkinson said the misinformation circulating about COVID-19 community transmission taking place in the Federation is not true. Neither are the authorities concealing any information on the matter. Dr. Wilkinson explains the situation.
It would be virtually impossible to hide from the public at which scenario we are at, especially as it relates to scenarios 3 and 4, as there would be obvious clinical manifestations with patients showing up ill at our health institutions, as we see playing out in countries and cities around the world. For example, it would have been impossible for Italy or New York to hide the fact that they were having widespread community transmission, which made them level 4. The approach that we have in fighting this disease is a whole of society coordination approach, where we are enlisting the help of all sectors of society in this fight. There is therefore no reason to conceal information to the public, as we have been totally transparent at every step, and we are enlisting their help at every step of the way. We, like all countries, except China, were at scenario 1 with no confirmed cases for a very long time until we had our first confirmed case on the 25th of March. We are now, as the Chief Medical Officer said yesterday, at scenario 2 with 11 cases. 8 of these cases had a clear personal history of travel, and 3 were related to persons who had a history of travel. These were sporadic cases. Now, as it relates to viral transmission and the stages of viral transmission, which is separate from the 4 scenarios that the World Health Organization describes, and I believe this is where persons mixing up. Stage 1 refers to imported cases, where the virus is brought into a country by someone who traveled from a high-risk country with COVID-19. Stage 2 is local transmission, where the virus is transmitted only to those in close contact with an infected patient. The cases remain within close family members or acquaintances. Stage 3 is what's described as community transmission. The persons do not have a history of travel to a high-risk country or had a history of being in direct contact with an infected person to become infected. Here, the circle of transmission becomes so huge that doctors cannot trace where or how this person became infected. And that is what's described as community transmission. And if this continues to escalate, then we get what's called an epidemic. And this is where you have a widespread rampant disease in the country, and it becomes a national health emergency. I close here again by saying that we are at scenario 2. We do not have community transmission at this time, and we need everyone to help us, to keep us at scenario 2.
Scenario 2 refers to cases related to a history of travel and closely associated cases to persons who may have traveled. Glenn Barth reporting for SKN Newsline.
You care about what goes on your skin. You care about the ingredients, organic and natural products. We have Rituals brand, Victoria's Secret, and much more. Discover the collection of prestige natural beauty. There are too many chemicals. Time to change. Go to Lucky's Duty Free at King's Pavilion Hotel on Bay Road, Bastille. Treat yourself as a princess. Also, Bath and Body Works coming soon. Check us out on Facebook. Open hours are from 8 a.m. to 7 p.m. Give us a call, 466-7059. Lucky's Duty Free.
Quality Diagnostic Laboratory, your newest partner in your healthcare. We offer the latest in on-island clinical laboratory testing. A comprehensive range of blood tests, urine tests, stool and other testing such as cholesterol and sugar testing, as well as hormone, kidney and liver functions, and many more. Quality Diagnostic Laboratory is located at the corner of Keon Street and Fines Avenue, opposite the Greenlands pasture. Our opening hours from 7 a.m. to 4 p.m. Monday to Friday are designed with you in mind. We are also open on Saturdays, 7 a.m. to 12 p.m. for your further convenience. Call or contact us at 465-6657 or email us at info@qualitydiagnosticlab.com. Quality Diagnostic Laboratory. Excellence in performance.
Looking for a clean haircut to make you look your best? Then come to Creative Barber Salon on Church Street, Bastyr. At Creative Barber Salon, you can choose from a wide variety of services: straight haircut, cut and shave, square and shave, children haircut, ladies cut, square, and much more. Customer service guaranteed. Opening hours Monday to Thursday 7 a.m. to 6 p.m. and Friday to Saturday 6 a.m. to 7 p.m. Call 765-0460. Visit Creative Barber Salon today on Church Street, Bastyr, specializing in all styles of haircuts.